Hello, this is Afri from Afri and today is a Instagram live session to discuss anything pregnancy related. I've got a few questions that I have put together, and I'm just gonna discuss it and then I'll share it on my social media. And if you have any other questions, you can send me a DM on social media, or you can ask on afribetter.org on the forum, and then we can discuss on there, which is a lot better because it's well documented. So one of the first one is, what are the traditional remedies for common pregnancy ailments such as morning sickness and back pain? For morning sickness, I think you just have to know what works for you and try different stuff. But the ones I have tried is ginger, lemon, and mint. And you can make it into a tea, as you can see here. So you can cut it up. That's mint leaves. And then you can cut it up and then brew it into a tea. And you can drink it morning, afternoon, night. I think the best thing about this thing is you have to incorporate it into your diet. So your body is changing and you have to change with your body. So you have to understand that, okay, my body is changing. What can I do to adjust, to settle my stomach and the rest of it? So it's not about looking for medicine to cure a sickness. It's more of like adjusting your body to welcome, the new being that is growing inside of you. I think that's what I've learned. Because my first pregnancy, I just kept on chewing ginger, you know, eating dry toast and the rest of it. And that was the wrong way of doing things. But by my third pregnancy, I understood a lot more as time went on that I just had to check and change my diet and incorporate some new things into my diet that will just help my body adjust a lot more. So by my fourth pregnancy, I was okay. I wasn't throwing up and the rest of it. So you just have to find what works for you. But I find out that drinking this kind of tea does help a lot. And no matter what part of the country you're in, you can just look for herbs. And when you talk about herbs being dangerous, I think it's more of like when you are drinking like a strong herb. But herbs are tea that you see in the shop. So when you want to brew your tea, so you have to brew it lightly and drink it and dilute it with more water because you know you're pregnant and you don't want to harm the baby. So herbs are fine, vegetables and everything are fine, but everything in moderation. That's what is required of you. In terms of backache, resting, my pregnancy pillow was my best friend from first trimester. I just used it to relax. A massage, you don't have to find anything expensive. Just you don't even have to pay for it. You can ask your husband, your partner, your friends, your parents, family members, anyone that is close to you that you feel comfortable touching you to just help you rub your back, massage it. And if you want to go a step further, pay for it. And the more regular you do it, the more you feel better or you feel comfortable during that time. And you look forward to something every time, having that massage. Warm compress. Warm compress is fine. So basically, put a towel in hot water and let the towel cool a bit, and just you can just wrap it around you, or just compress it on your body, your shoulder, your back, everywhere. Or you get someone to do it for you. So on a regular basis, basically, I think pregnancy just humbles you and tells you you just need to slow down a bit and love your body more. so that you can enjoy your body, because your body will keep stretching and keep growing, and you just have to introduce things to just balance everything. And prenatal yoga, there's so many videos online, so many videos online that you know that you can just go go on YouTube, just play one of them, and just have a mat on the floor and just stretch. You know, I think you should just incorporate it into your routine, like every week or every 2 weeks or so. Just have a me time, and there's no need of buying anything, no need of going to anywhere expensive. You can do it in your house. So, and that's the good thing. And I think, yeah, just your mental health just matters a lot. Researching and just doing things that you feel that your body really likes. When you try something and your body enjoys it, just stick to it and just keep being consistent. And it will help you enjoy the pregnancy a lot more. Because not everybody naturally has a good pregnancy. You have to work for it, to get that, that fairy tale that some people talk about effortlessly. Remedy for toothache during pregnancy. For me, for my first pregnancy, I had toothache. Second one as well. And the third pregnancy, I did a mistake. You know, I was chewing on Orobo bitter cola, and it did affect my teeth. And the reason why it affected it was because I wasn't maintaining good oral hygiene. So the days I felt down or I felt sick or I was just scared that I was going to throw up if I put a toothbrush in my mouth, I would not brush, you know. I'll just rinse my mouth or just use a plain toothbrush on the teeth. But I realized that that was not the way to go, because if I did throw up or anything happened, the acid of the what's it called, the throw up can stay in my mouth. So, but I wasn't throwing up in my third trimester, but I just wasn't maintaining too much of a good oral hygiene at the beginning until when I realized what was happening. And then I got the Listerine non-alcoholic Listerine mouthwash, and I was using it regularly. I think I spoke to a dentist and he said you should just keep using it even though you're not brushing. But I was actually brushing twice a day and was using the Listerine. But the damage was already done, but I still continued. And I think if it's your first pregnancy or your second pregnancy or multiple pregnancy, I think for your first pregnancy, it's best you know all of these things. So you start with it, knowing that your gums and everything are going to be so weak, and maintaining oral hygiene the best way possible will help you keep your teeth, to be honest, because there are so many people that are losing their teeth. I lost my teeth as well, and that was just based on pregnancy. And it wasn't that pregnancy took my teeth away, but it's just that my gums were so vulnerable. So for my first pregnancy, when I started having toothache, I just chew on clove, like the old clove in here, just one or two, and it worked magic. And that way, it settled my belly as well. And then I would just brushing, and then clove water, just rinsing with clove water would do the magic as well. So just maintaining proper oral hygiene will really help you, with toothache and not developing something afterwards. So, what are some tips for navigating the healthcare system during pregnancy in any part of the world, Nigeria, UK, and the rest? Doing your own research is very important, and that's why I'm sharing this video, because it's part of your research if you come across it. because you need to know exactly, the questions to ask when you go to meet a health practitioner. It's very important. It's like going to anywhere. Knowing what you want is the first thing you should do. And you shouldn't be naive with pregnancy as well, because it can cost you a lot. Because being naive in your first pregnancy and it leads to CS, and you're like, oh, I will try for a vaginal birth the next time. And they tell you in the hospital that, sorry, we don't accept VBAC. And you be like, why? But some of us just went through CS in the first pregnancy because we felt that it was cool, and we felt that we didn't want to stress ourselves, but we didn't realize that we can actually change our mind in the second pregnancy or the third pregnancy. And the more CS we have, the more nobody will want to bet on us, because they're taking a chance on you. But if you get it right the first time, and you understand why you're going to the hospital, you will know the questions to ask, you know, and you'll be in control a lot more. And don't be afraid of the medical jargon. Whatever you don't understand, just ask the health practitioner to explain to you in a layman terms so that you understand exactly what they're saying. And most doctors have the habit of just, throwing numbers at you, saying things that it's not really relevant to you, but they're just saying it because they know it. They just want to look smart in front of you in most cases. And you'll be scared. They'll be like, oh, what do they mean by that? What do they mean by that? Because I see forums and people bring in their record, oh, it's 57% E phase, this and that. They're just data that they're keeping, you know. So don't be scared of the medical jargon. The ones you're worried about, find out about it, ask them about it, and they will explain, you know. And then understand that the doctors and nurses work for the hospital and not for you. Yeah, they will most likely do what is best for the hospital than do what is best for you, even though they will tell you that they are doing what is best for you. So you just have to know that the job is in your own hands. Some people have it lucky. They go through pregnancy very well, no problem. And before they get to the hospital, just at the edges of the hospital, they've given birth. Some of us have to work for, for everything that we get. But being naive is one big mistake. For my first pregnancy, I was so looking forward to the due date. I so believed in the system. Everybody, you would say, oh, I have a headache. Oh, speak to your doctor. I have this, I have that. Speak to your doctor. And doctor will be like, oh, everything is fine. Toothache is natural. But there are things that you can use for toothache. There are things that you can use for nausea. There are things that you can use for backache, even though they are normal, but you can still use things. It doesn't have to be chemical, it doesn't have to be any medicine, just natural stuff that will make pregnancy easy. And that's when you should know that hospitals don't know everything. They are trained for emergency first before preventative procedures. They are trained to take the baby out of you, whichever means necessary, than say that, oh, can you squat to see if the heartbeat will drop? Or can you change positions to see if the heartbeat will become normal again? Can you squat or be on all fours to prevent tears? No, they lie you down on the bed because they have to have access to checking in. That is the reason why they lie you on the bed. It's for them to have access to you. It's not because it's the best way for you to give birth. When they tried to convince me to have a hospital birth for my last baby, They started showing me the hospital bed. They were like, oh, yeah, we've changed so many things. And what did they change? They were like, oh, now we're now allowing women to birth the way they want to birth. So if you want to squat, if you want to hold on to a pole, we have all of that. I'm like, it should have been there from day one. But I didn't know better from my first pregnancy, my second pregnancy, and my third pregnancy, I knew a lot more, but I still fell for, oh, go to the hospital first. So if you don't have any underlying medical condition and your scans and your bloods are up to date, there is nothing wrong with any of it. And you're confident within yourself and you're praying as well, you're meditating. You have to take some steps to make sure that you achieve what you want. If you feel that, you know, you might not naturally fall into that position. So it is best to labor at home to increase your oxytocin level, which is like a happy hormone that your body produces. And it does help with labor. I see people say that, oh, I was just at home, just chilling, hanging out with family, which is what happened to me. And, I just drank something, and before I knew it, I went to bed and I went into labor. And when I started having the pains, I stayed at home with my family and my labor progressed. Like, if I didn't rush to hospital, I would have given birth at home. But for some reason, if you actually go into the hospital when you started having little pain, for some reason, you be in the hospital and you will not progress. You can be there 1 day, 2 days, and you'll be having pain, but you will not progress more than 1 centimeter. Why? Because of the environment. You're scared. Your body is confused. You know? So you just have to be careful. As long as you don't have any medical condition, then birthing is more natural than medical. It becomes medical when you have to have CS. It becomes medical when you have underlying conditions. So I'm not saying that you shouldn't do CS or you shouldn't be in the hospital, but you have to know where you fall in and then know the procedures that you have to take. If you are in pain, look for pain management, squats to help with your labor. You know, if your water hasn't broken, have sex, drink away to do things that would help you progress before you get to the hospital. Because if not, you get to the hospital and your life is in their hands and they can do whatever and they can tell you whatever. When the baby is in distress, it's the things that is done after that can cause any problem or fatalities. Having a tear is the way you birth that can cause that. The way the baby is dragged out of you, that can cause that. So we just have to understand a lot more and understand about birth. And that way we'll be able to go into the hospital at the right time and just come out without no problem. But if you have a medical condition, I understand. But there's still things that you can do. So just find out. And there's so many communities out there. I know that we Africans are not creating a lot, and that's why I'm creating this, that we can discuss a lot more. We're not trying to be Hebrew women. Oh, we're just saying that we have to empower ourselves because they are turning pregnancy and birthing into medical, which shouldn't be. Nobody is shaming CS, but we are not doing enough to make sure that we are having natural, non-traumatic births. People have third degree tears like fourth degree tears. People have so many things that they can't talk about just because the hospital did it their way. I think I read a bad story whereby the lady finished giving birth and she said they didn't even wait for the placenta to come out. The nurse just entered with her hand and just yanked the placenta out. And after that, she started bleeding. But the hospital told the husband to go and get more blood. In the first place, they didn't have to. I was on all fours in my bath for 15-20 minutes and I could just feel that the placenta was coming out bit by bit by bit. And it just, after 20 minutes, it just came out. There was no injections, nothing. It just needed time. It just needed that environment. It just needed that calmness. My body was calm. My body was in control and it did its thing. So I think going to the hospital, you're hearing people scream too. It can mess up with your head. So you just have to be in control a lot more. Speak to your husband, speak to your friends, your family, people around you. Surround yourself with positive people that understand birthing. Not people that say, oh, go to the hospital, go to the hospital. And you get to the hospital, doctor does not know anything. All they can just offer is, oh, should we induce you with artificial stuff and see if it works? If not, we have to go for CS. That's a lazy way of doing things. So this is from my own personal experience, things I've experienced before I got to the fourth birth. Because I had vaginal birth after 3 cesareans just because of I was naive. That's all. Nothing else. So what are some tips for preparing for manageable and positive childbirth? I think I've mentioned some of them. Prepare yourself mentally so you can deal with any situation that arises during labor. Have a birth plan. Whatever country you are in, don't even say, oh, I'm in Africa. They don't listen to birth plan. Birth plan is for you. It's for you to say, okay, these are the things that I've done. These are the things, this is what I want. It might not go as planned, but at least you have an idea and you're working towards that idea. And surround yourself with a birth partner, either your husband, your friend, your mom, whoever truly knows what you want and they support what you want. And if you don't have someone that supports what you want, you have to be in control a lot more. For me, my husband did not support VBAC, but I did educate him. I did carry him along. And when it got to it that I was in labor at home, he had already read as well, and it was helpful throughout. So don't be down because your partner is not on board. They're scared, but you still have to carry them along. And drink your ewedu or okra water or any kind of drink that you've researched. Herbs that you've researched. There's so many herb centers in Africa. I know they will tell you herbs are bad, herbs are bad, but they're not even investigating. It's just a popular opinion. I feel personally it's a conspiracy because I used herbs throughout my pregnancy in moderation and everything was fine. You just have to know where you go to. Let them give you the stuff in front of you and you can mix it at home. For the names of every herbs that are given you to. If the person is not comfortable telling you the name, then move on to the other person. It's just as simple as that. Don't just let popular opinion just lead you astray. And you'll be like, oh yeah, I was in labor for 3 days and they had to do CS. But what did you do beforehand? And then find the perfect birth positions that works for you. I found that every time I kept on squatting, I'll go to the bathroom, squat in my room, squat. Like I want to poop. And when I squat, I feel like actually towards the end of the pregnancy, like the baby was down there. You need to see my belly at the end of the pregnancy. The head of the baby was literally down there. And I knew that, yeah, this baby was ready for vaginal birth. Because I could feel, because everything I was doing, the baby was, the way to just, the baby was down there. The way to just kept the baby down there. The squatting, the exercise. And that's what you want. The baby is in the birth canal. And baby does not have to be in the birth canal straight away. It can be while you're contracting. I didn't have any checks in my fourth pregnancy. No sweeps. I even requested for a check. They were like, oh, they don't want to induce me because checking can induce labor. Isn't that funny? Because my three pregnancies, I was checked throughout and they were never worried that I was going to induce labor. But now that I'm aware of exactly what I'm doing and I'm telling them what I want to do, everything is off the table. So you have to know what you want. Whatever part of the world you are in is very important. It's not, oh, yeah, this does not happen in Nigeria. The nurses will tell you what to do. No, you have to empower yourself. This does not happen in the UK. Yeah, I should be happy. I'm paying taxes, so why do I have to worry myself? But what if you decide that you don't want CSA anymore after your first CS? What are you going to do? So find the perfect positions that works for you. Waterbed, squatting, on all fours and much more. They would not allow you in most hospitals. But you have to find your way, you know. In most cases they ignore you anyway till the baby is coming out. So why not squat by your bedside? Why not be on all fours? You know, and if you're in the Western world, why not have a water bath? You can request for a water bath. You know, so I think you just research and try as much as possible to be in control. These are the best betting position. Sideline, which you have the bed for that. So squatting on all fours, semi-reclined, and then the betting bar, and then whatever is best for you. What are some tips for postpartum care? Clove water. Yeah. I remember when I had the baby, I went on the forum and then asked, what can I use? And the lady just replied, said, clove water. Clove water is what it is. So just like a tablespoon of clove water, as you can see in this picture here. And put some water in it, boil it, and then you can do it the African way and just sit down on it. But put a tablespoon of salt, a tablespoon of salt. You can put it all just a little bit if you want to, but if not, just let it cool. So you want it warm, you don't want it hot. And then there's some sitz bath bowl that they have that you can just fit into the toilet and just sit on it and the steam. is what just does the job for you. So after having your baby, and just do it on a regular basis. I actually did it for a couple of days, and it does help with intimacy and you feeling yourself. I actually felt like, nothing happened. I don't even remember anything happening now. Nothing at all. But I think it's whatever you do afterwards matters a lot. Whatever you do before and after, trying to prevent the tears in the first place, trying to prevent the trauma in the first place, and then afterwards as well, trying to get yourself back, So they're all important, but don't put pressure on yourself. Whichever one you can do is fine. And if you're not able to do any of it, it's okay. But just try as much as possible so that you don't have any trauma afterwards. Being overdue is not a big deal. It's called estimated due date. It can be before, it can be after. I'm sure that very soon they will start coming with the theory that the machines were not even working in the first place. So don't pressure yourself for the due date. Just prepare your body and make sure that you're checking yourself. Make sure that everything is fine. Your water hasn't broken. You don't have an infection. And just stay safe. If you're worried, let them check the heartbeat of the baby. And if everything is fine, just keep on with your pregnancy. I had my baby at 42 weeks and 2 days. People have it for 3 weeks, 44 weeks. I know we are all scared, but we need to address the elephant in the room. Is what are the things that we do that can give us a better result? That's what we want to work on. We want to lower maternal death, but not by putting ourselves through what we don't want to go through. Not by going through major surgery and not knowing how to come out of it. No help. In abroad now, help. Your husband is not even ready to help us. It's not that he's a bad person. He just is not in that right state of mind. So, and then when we see something online, let us check what it is that we have locally. Because I see people from Nigeria and Africa asking, oh, where can I get red raspberry leaf tea? I bought red raspberry leaf tea because I'm abroad. But Nigeria, Africa, they have so many other local herbs. Ewe I'm sure the Igbos, the Ghanaians, the Jamaicans, the Kenyans, they have their local herbs. Use it. Just use it in moderation and use it when needed. For me, I waited for me to be overdue on their own date, and then I drank castor oil. I drank it for my third pregnancy, but I drank it too early, maybe. But my body was not ready. But I was still in that mentality that hospital knows best. But for my fourth baby, I was 2 weeks overdue. Baby was weighing 4 kg. But I didn't ask for any help at the hospital. And I had no medical problem. So I listened to my body, drank a bit of castor, And that same night, I had my baby 2 hours later. No sweep, no cervical checks, no infections afterwards. Because my third pregnancy, they kept on checking me. And I knew that, of course, they had already broken my water. So I was due to have infection. Not because of anything, but because they were the one introducing the infection into me. I know we don't want to blame hospitals, we don't want to blame medical practitioners, but they are doing things. They are doing a lot of things, and we know it. But we're like, oh, as long as I am the baby are okay, everything else is fine. Everything is secondary, but it's still at the back of our mind. So my point is, the job is in your hands and the hand of the father. So if you are the father watching this, speak to your wife, and then you guys just educate yourself a lot more. Your strength, your preparation and research can help you get the result you want. Betting position matters, betting environment matters. You know, I labored and I gave birth on my own force. I remember when the labor started, I just knew what to do. I went to my room, went on my exercise ball, laid my shower curtain on the floor, and I just kept on bouncing on my ball. I had my clary sage oil, and I just like put it in my diffuser, used paracetamol, and I just kept. I didn't even know that I was going to give birth that night. I just knew that something was starting. I'm just being in control. Did help me a lot. You know, when the pain was getting worse, I was holding on to my bed, but still bent because I told my husband, because I've been practicing, how to lie on the bed with my bum hole up so that the pressure is going down. And these things, they do matter. So as time goes on, I would pick on each topic that I have mentioned here, and then we talk about it at length. I will try as much as possible to get more videos out there. It took me so long to be able to do this. I'm doing it in the middle of the night when everybody's asleep. So I will try as much as possible to get more information out there, and we can discuss more on the forum afribetter.org. You can ask questions, and then anybody can answer. I can answer as well. So we Africans, we need to talk about it, and understand what it means to birth. We're not talking about shaming CS. We're talking about educating ourselves a lot more and understanding what it means.